Medical emergencies can happen any day in any setting. Given the large number of injuries and sudden illnesses that occur each year, it is possible that you might have to deal with an emergency situation someday. If you do, you should know who and when to call, what care to give, and how to give that care until emergency medical help takes over. Cardiopulmonary resuscitation (CPR) is an emergency procedure that combines chest compressions with artificial ventilation. Successful CPR will preserve brain function until further measures can be taken to restore breathing and blood circulation in a person who is in cardiac arrest. CPR is recommended for those who are unresponsive with no breathing or abnormal breathing. CPR can help save a life during a cardiac or breathing emergency. However, even after training, remembering the CPR steps and administering them correctly can be a challenge. Before giving CPR, check the scene and the person. Make sure the scene is safe, then tap the person on the shoulder and shout, "Are you okay?" to ensure that the person needs help. Call 911 for assistance. If it's evident that the person needs help, call or ask a bystander to call 911, then send someone to get an AED. If an AED is unavailable or there is no bystander to access it, stay with the victim. Call 911 and begin administering assistance. Open the airway. With the person lying on their back, tilt their head back slightly to lift their chin. Check for breathing. Listen carefully for no more than 10 seconds for sounds of breathing. Occasional gasping sounds do not equate to breathing. If there is no breathing, begin CPR. How to perform CPR. Compressions. For chest compressions to be the most effective, the person should be on their back on a firm, flat surface. Position your body correctly by kneeling beside the person's upper chest. Place the heel of one hand on the person's sternum or breastbone at the center of his or her chest. If you feel the notch at the end of the sternum, move your hand slightly toward the person's head. Place your other hand directly on top of the first hand. Keep your arms and elbows as straight as possible so that your shoulders are directly over your hands. Give 30 chest compressions by using your body weight to push hard and fast. Compressions should go at least 2 inches deep. As you give compressions, count out loud. 1 and 2 and 3 and 4 and 5 and 6 and up to 30. Push down as you say the number and come up as you say "and." This will help you keep a steady, even rhythm. Rescue breaths. Once you have given 30 compressions, open the airway by tilting the person's head back and lifting their chin up. Pinch their nose shut with your fingers and place your mouth over their mouth to make a complete seal. Blow in for about 1 second to make the chest clearly rise. Give 2 breaths. If the chest does not rise with the initial rescue breath, re-tilt the head before delivering the second breath. If the chest doesn't rise with the second breath, the person may be choking. Look into their throat for an object, and if you see something, remove it. Repeat. Continue cycles of 30 chest compressions and 2 rescue breaths. Each cycle of chest compressions and rescue breaths should take about 24 seconds. Keep performing cycles of chest compressions and breathing until the person starts breathing on their own, or an AED becomes available, or a trained medical responder arrives. End the cycles if the scene becomes unsafe or you cannot continue performing CPR due to exhaustion. How to use an AED. An AED, Automated External Defibrillator, is a small, lightweight device that analyzes a person's heart rhythm and can recognize irregularities. Different types of AEDs are available, but all are similar to use. Most can be operated by following these simple steps. Turn on the AED. Expose the person's chest and wipe it dry. This ensures that the AED pads will stick to the chest properly. Apply the AED pads to the person's bare, dry chest. Make sure to peel the backing off each pad to expose the adhesive surface before applying it to the person's chest. Place one pad on the upper right side and the other pad on the left side. Plug the connector into the AED if necessary. Let the AED analyze the heart rhythm, or push the button marked Analyze if indicated. Advise all responders and bystanders to stand clear. No one should touch the person while the AED is analyzing. If the AED advises that a shock is needed, make sure that no one, including you, is touching the person. Say, "Everyone stand clear." Deliver the shock by pushing the shock button if necessary. Some models will deliver the shock automatically, while others have a shock button that must be manually pushed. After delivering the shock, or if no shock is advised, perform about 2 minutes or 5 cycles of CPR. Continue to follow the prompts of the AED. If at any time you notice an obvious sign of life, such as breathing, stop performing CPR and monitor the person's breathing and any changes in the person's condition. In conclusion, CPR can help save a life during a cardiac or breathing emergency. Remember to check the scene, call 911, open the airway, and check for breathing. Perform CPR by repeating cycles of 30 compressions followed by 2 rescue breaths until the person starts breathing or professional medical help arrives.